Thank you for having me. As she said, I'm Stacee Delise. On December 1st, 2016, I received a phone call while at work that would change everything about my life for the next 2 years. And I apologize because I have spoken several times and never cried, so I don't know why I'm emotional today.
You can apologize now.
But my 12-year-old daughter, Kennedy, had attempted suicide while she was at school. And over the next 12 months, Kennedy would attempt suicide 5 more times. And I'm sitting before you all today as a mother, someone with their own mental illness. And I also standing before you, or sitting before you as a mental health professional in the state of Colorado. I hold an LPC. I've worked in community mental health. I had worked in community mental health at the time for over 11 years. And all of my years as an LPC at the community mental health center in my town, I never could have predicted that I'd be talking with my peers and people that I supervise about my daughter's illness and her safety. Now, Kennedy will turn 16 in February. And she's at home today, alive and well, minus the fact that she came home early from school with the flu. And I drove over to you all from Delta, Colorado, which is about 5 hours away. And she's alive for one reason, and that reason is time. And when I thought about what I wanted to talk to you all today, 2 things came to mind: time and lessons learned. The time that Kennedy was given to have her depression and suicide ideation assessed and understood and treated did not come easily. Kennedy was afforded the time to receive treatment that she needed because she had a mom who worked in the field, who literally could pull strings. I was able to call Andrew Gabor at the state level of Child Mental Health Treatment Act and ask questions and find resources. She had a mom who could call the CEO of her company, to call the CEO of the ICU where she resided in the hospital after an attempt that nearly took her life, who called the CEO of Denver Children's Hospital and told the transport team to send the flight to get her, even though insurance is waiting for an authorization code and they're hesitant to send the plane. Send her to get this girl. We've got to get her to the ICU here. All so that she could have a shot at being in Gary Pavilion, because we have been in several other hospitals and resources on our side of the state, and we weren't getting anywhere, despite their best efforts. She had a mom who had 2 incomes, who had good private insurance, who literally was pulling strings to get her the best treatment that we could. She had a mom who knew to call insurance and request a utilization review, to request a stay put, who knew how to fight the insurance world to keep her treatment while she was getting better, because I wanted to release her. She was very much still symptomatic and not better. And as I sit back and look at the lessons learned and what it took for me to get Kennedy to treatment and to stay in treatment, and I couldn't help but think about the clients that I had served over the years and the clients that I was going to continue to serve in my role at my organization, who did not have any of those things that I had, who could literally pull strings within the system to get their child the best care on the wait list, all of the things. And that it was that much harder for me. It was almost impossible for people who didn't have what I had to get their child help to keep them there. And we had two Child Mental Health Treatment Act evaluations, and one was phenomenal, and the other set us backwards in treatment and getting her care. And I fought with insurance, and I had Child Mental Health Treatment Act, in place for her. And in our side of the state in Western Colorado, there's not enough of those evaluations for the organization I was with that I worked for to dedicate one person to manage that. And so, and I don't hold it against anybody or them, but being able to follow through on the steps needed to have Child Mental Health Treatment Act take over and start paying for her treatment just didn't happen. And I wasn't willing to let that happen and have her come home in the middle of her treatment against treatment recommendations. Insurance, we were on every other day authorization to keep her in residential treatment. And insurance was every day making us request new, and they finally said January 4th is her end date of when we'll authorize treatment. She was slated to be in treatment until March 15th. So I needed to go to my local child protection services in the county, sign over physical custody of her, gave custody of her to the state so she could have Medicaid, so she could stay in treatment. She left treatment on March 15th of 2017 for good, and came home with Medicaid for a year. We also came home with services in place of them to keep checking up on us, to keep our case kind of open and make sure that the transition home was fine. And I knew to do that because I lived this world and worked in it. But people don't know to do that and how to navigate it, and it should not be so hard to get treatment, to get told by insurance that your kid is well enough to come home when the doctors are saying they're not. And my lesson learned, my takeaway was that none of us can fight this alone. And I had everything in the world to help Kennedy get the treatment she needed. And it was the hardest thing I've ever done. I put 40,000 miles on my car that year, driving from my home to this side of the state. Spent hundreds of dollars on hotels and food so that I could be here for her and have visitation and still go home and work and take care of my other daughter. And most of the people in Colorado don't have the means to do those things or the access to that, particularly our clients or families that have lower resources. So I made it my mission, once she was home and steady and I could continue on with life knowing that she was well, that I would help the other families fight the way I fought for Kennedy to make sure she had treatment and getting where she needed. I don't think that our system is totally broken. It's just hard to access. We have great professionals. They're caring and competent and very knowledgeable, and they want to help. But getting in there can be hard. Getting to stay in residential treatment is very difficult if you have private insurance. It was very costly. It cost us a lot of, prior to Medicaid picking up, we paid several $100,000, we paid several $1,000s in medical, in my portion of her bills for her to be in treatment. And that year she was in, I find my notes, she was in 5 inpatient hospital settings, all through M1 placements, 2 residential treatment centers, 5 ER visits, 2 ICU stays, 8 months total of time spent in treatment outside of our home. And over $500,000 billed out to our insurance company in her name. Now that's not what they paid, right? Because they negotiate their rates, but that's what was billed out in her name. And every bit of that came at the expense of me literally fighting the system to get her treatment. And she's here and alive today because I was able to do that. And I promised her and others that I would make myself available for other people to navigate that system when it's difficult. And I've done that with several families. And I come before you today as a part of that it's not a totally broken system. It's just not easy to access. I recently helped somebody get into the hospital for inpatient care. And all of the bigger hospitals across the state, you can't get individual treatment while you're in the hospital. You get group. You get a cookie cutter treatment plan while you're there because individual isn't reimbursed at a high enough rate for them to make that sustainable. And not everybody needs the cookie cutter treatment response while you're in an inpatient hospital. Some people need individual treatment in that safe setting to begin whatever they need to begin in order to come home. I think that we need to fight for our insurance companies to pay more, the reimbursement for individual and group and all services. We need to figure out a way to have more resources on the other side of the state so that kids can receive all levels of care in their community. The few things that we have in Western Colorado are great, but they're just not enough. At one point, I considered moving to this side of the state, because I didn't know where Kennedy's treatment was going to take us for a long time. She's got 2 types of depression, runs in my family, and I didn't know if she was going to ever get to a place of recovery. So I thought I'm going to have to live on this side of the state, uproot my life, so that I can have all of the treatment options available to her. And that ended up not being the case for us, but they're not on our side of the state. And I know that there's not quite the demand on our side of the state, but that doesn't mean we don't have needs. Our small town suffered its fourth suicide in 2 years at just one high school in our small town just this last weekend. We have a suicide epidemic on our side of the state with shortage of professionals and shortage of resources. And then once you're in treatment, if you have private insurance, it's almost impossible to stay there. And I talked to somebody just last week that said, I was told my kid can't get into treatment until they try and fill outpatient so many times. And I recall that feeling of waiting to see when Kennedy would get bad enough for her to attempt again, even though I was restricting everything she could attempt with, in hopes to God that she wouldn't die so I could get her to Gary Pavilion. But I knew I had to get her in Denver Children's Hospital first in order to have a shot at Gary Pavilion.
Stacey, you have about 20 seconds.
Oh, thank you. So, I guess I want to sum up with people need time to get better, and they need to be able to stay in treatment to do that. And we have got to offer the resources for them to do that, and support our families in knowing how to access the services and where to go and what to do if it's not working, so that they can have the same shot that Kennedy had to get better. Thank you.
Thank you.